Hello, welcome to the Science Guide ASAP Learning. Today we are going to be speaking about retinal detachment, causes, clinical presentation, diagnosis, and surgical interventions. Causes of retinal detachment. Retinal detachment occurs when the retina, the thin layer of tissue at the back of the eye, separates from its underlying supportive layers. Let's explore the causes of retinal detachment. Age-related changes and degeneration of the vitreous humor can lead to retinal detachment, especially in older individuals. Trauma or injury to the eye, such as a direct blow or penetrating injury, can cause the retina to detach. A family history of retinal detachment increases the risk of developing the condition. Certain eye conditions like myopia, nearsightedness, diabetic retinopathy, or previous eye surgeries can also contribute to retinal detachment. Clinical presentation of retinal detachment. Recognizing the clinical presentation of retinal detachment is crucial for timely intervention. The following signs and symptoms may be observed. Sudden onset of floaters, which are small spots or cobweb-like shapes that appear in the visual field. Flashes of light or photoxia, described as seeing brief bursts of light or flashes. The perception of a curtain or shadow effect in the visual field, indicating a partial or complete detachment. Decreased or distorted central or peripheral vision. It's important to note that retinal detachment is usually not painful. Diagnosis of retinal detachment. Diagnosing retinal detachment involves a comprehensive examination performed by an ophthalmologist. The following steps are typically involved. Dilated fundus examination to assess the retina's position and look for any tears or detachments. Visual acuity testing to measure the sharpness of vision. Measurement of intraocular pressure to rule out glaucoma as a potential cause of symptoms. In some cases, when the retina cannot be clearly visualized, ultrasonography may be performed to assess the retinal status. Surgical interventions for retinal detachment. Prompt surgical intervention is necessary to reattach the detached retina. The choice of surgical procedure depends on the severity and location of the detachment. Common surgical interventions include pneumatic retinopexy. This procedure involves injecting a gas bubble into the eye to push the retina back in place. Laser or freezing treatment is then used to seal the retinal tear. Scleral buccal surgery. A silicone band is placed around the eye to provide external support and reduce tension on the retina, allowing it to reattach. Vitrectomy. This surgical procedure involves removing the vitreous gel and any traction on the retina. The space is filled with either a gas bubble or silicone oil to help reattach the retina. In conclusion, retinal detachment is a serious condition that requires immediate attention. Understanding the causes, clinical presentation, diagnosis, and surgical interventions is vital for timely management. If you experience sudden changes in vision or suspect retinal detachment, seek prompt medical evaluation to prevent permanent vision loss. Hope this helps. Please support this new channel by liking this video and subscribing for more videos like this one.